November is Prostate Cancer Awareness Month, and for men like Samuel Mukasa Cheza, this month rings home the need for every man above 40 to test for the disease. Cheza was diagnosed with prostate cancer in December 2019 and is still on treatment.
In men's washrooms, you meet those posters, prostate cancer. And when I read it, I found that I could be having such symptoms, like urinating so much in the night.
Prostate cancer is the leading cause of cancer mortality among men in Uganda. In 2018, there were 2,086 new cases of prostate cancer and approximately 1,177 deaths. Statistics show that 70% of newly diagnosed cancer cases die within a year because by the time they are referred to the Uganda Cancer Institute, they have stage 4 of the disease. For Samuel Majwega Msoke of Prostate Gland Initiative, this means an uphill task in creating awareness and dispelling myths.
You talk to people, and people, they just run away. Like we had the sensitization in Muguru. We had over 300 people, but when we look at the number of people who came for check, for free check, they were less than 20.
A late diagnosis can complicate a patient's economic life. Dr. Jacinto Amandua, a former director of clinical services in the Ministry of Health, is now cancer-free. However, judging by the cost of his treatment, he says many people, unfortunately, cannot afford cancer treatment and care. At the diagnosis level, a multitude of tests range from 10,000 shillings to 200,000 shillings. At the evaluation level, he spent 300,000 shillings on a CT scan and 950,000 shillings on a biopsy. Then, chemotherapy cost him 140 million shillings. Now, his annual checkup costs between 1 million and 1.5 million shillings.
Access to cancer services should be free because no person in this country, however rich, at the end of the day, will have faced some financial challenges at the end.
Christopher Kwizera, the head of Secretariat at Uganda Non-Communicable Disease Alliance, concurs that NCDs are now more of a development concern.
It's going to hurt everybody. Those of us who are here, claiming to be working and earning those small monies, you keeping it today, you're enjoying, like he's saying, in the next time when you're 50 years, 55, when reality starts coming to you, you're not even seeing what you've made, but you need to spend on your health when you have nothing to spend.
The way forward is to advocate for prevention. Risk factors for prostate cancer include age, family history, a high-fat diet, and minimal activity. More training of lower-level health workers is needed so that they can be suspicious of lingering wounds and recurring swellings on their patients. This will go a long way in helping early diagnosis.
Because the health man come and go to the health center too, the nurse there will be say, hey, Muse, your wound here is not healing. You go to see so and so. But if she doesn't have the knowledge, you will treat that person there for years. By the time they refer, it will be late.
However, even with the early diagnosis, a critical mass of health workers with the necessary expertise and equipment should be available in every regional hospital to treat the rising cancer cases. Gillian Nantume, NTV.